Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And we're here at the eClinicalWorks Enterprise Summit, and our guest is Danielle Graham. She's EMR Clinical Integrations Manager at the Little Clinic. Welcome, Danielle.
Yes, thank you, John, for having me. It's a pleasure to be here.
Yeah, so excited to learn about your experience with ECW and their product, but before we do that, tell us about yourself and the Little Clinic.
Sure, so I am a nurse practitioner by trade. For the Little Clinic, I am their EMR Clinical Integrations Specialist or Manager. So anything that falls clinical under that umbrella falls into my category. I have been with the Little Clinic for 10 years, so within this last year, I just took on that EMR role. The first 9 years with the Little Clinic, I was a nurse practitioner within their clinic. So I got very familiar with the front end of ECW. This new role, I'm now learning the back end, which has been a very big change, but for the better, for sure.
Sounds good. Well, I always love having clinicians that actually use the product.
Yeah.
So tell us, what has been your experience on the clinical side with eClinicalWorks?
For sure. So again, I was in the clinics for about 9 years. So we've seen and we've worked with eClinicalWorks for probably the last 18 years. So I've really had a chance to see the evolution of what it was to what it is now, and the advancements that it has made is tremendous. It's definitely improves our workflows, makes life a little bit easier when you're actually sitting in front of the patient, trying to document their history and their visit and so on and so forth.
Interesting. So talk to us about the workflows. I mean, I think at the end of the day, it's all about the workflow for the clinician.
For sure.
And getting it away. Tell us, what are some of the enhancements that have benefited you in the workflow side?
Yeah, so it used to be a lot of a manual process, from registering the patient when they show up for their appointment, getting all of their demographics updated, getting their insurance and driver's license scanned into the chart, to the actual visit where you collect all of their medical history, you collect their symptoms, what they're being seen for today, you actually diagnose and treat. So it definitely is a lengthy process, but the way eClinicalWorks has evolved, they have what's called HELO, which we use for our patient registration process, and it makes it more of a contactless check-in, eliminating a lot of that manual work, more just verifying that all their information is correct in the system. With the version 12 upgrade, there have been several usability enhancements that we have really shined light on that help us, help our clinicians be able to shave a couple minutes off of a visit. And that may not seem like a lot, but when you're seeing 20 to 25 patients a day, being able to take a minute or two off of each of those visits really gives you the ability to potentially see a couple more patients.
Right, or to go home without, taking charts home.
Exactly, being able to get your work done in your working hours.
Yeah.
So some of these enhancements, I would say, there's a thing called a right chart panel.
Okay.
And when you're in the progress note, you open up a section of the progress note, you have the ability to pop open that right chart panel. And on that chart panel, you can see previous encounters for that patient. So instead of having to completely get out of your progress note to look back at a previous visit to get information or ask the patient, to figure out what they were prescribed the last time,
Sure.
you can, the linear ability to just click that button, pop it out and see it right within that screen has been huge. Again, it has the potential of shaving time off of a visit and gives the provider more time to have that patient interaction face to face instead of being knee deep into your computer screen.
Yeah.
In that same window, you have the floating toolbar,
Okay.
and that has several different features. It's kind of similar to that right chart panel. It allows you to access a patient's documents, their prescription screens, the timeline of events of when they've been seen within our practice. So just being able to click on that and open up that window and then get right back to the progress note, the efficiency is huge.
Yeah, it's interesting to think about that evolution of EMR, because when we first started, there wasn't all the history, right? It was in the paper charts.
Right.
Now there is all that history, and so being able to access that information has become really important, and doing it in an effective way. How has that helped with things like burnout? I mean, we know it's a big problem in healthcare organizations in general, right? How has some of these changes impacted them and these workflow enhancements?
For sure. So I think a lot of the times when you look at providers or nurses or advanced practice providers, they go into that profession because they want to help people. Yeah. So having that ability to sit there and communicate and have that conversation to be able to help them it's so important. It's so valuable. And when the processes are more timely and you're spending more time staring at that computer screen than you are interacting with your patient, that's a problem. And ECW has made it so efficient that we are able, again, like I said before, to have that interaction with them instead of sitting there staring at that computer screen.
Yeah, and I want to go back to something you said that I don't think a lot of people realize, which is if the front end process is wrong, right? You don't have the right insurance info, that impacts your back end process.
Oh, for
Talk
sure.
to us about
100%, yeah. You know, these claims, if you have any piece of the demographic wrong for a patient and you go to submit a claim to their insurance, the insurance isn't going to recognize it. It will deny the claim, and it starts that process all over again. So that registration process, it can be very, very tedious for the patient that we're having to capture all of that information every time. We're verifying it each and every time. So that's why it's nice that we have this contactless check-in process to be able to do that for us.
Yeah. Well, and then if you make sure you have the information for the doctor to be able to understand,
Correct.
right? Like,
Yes.
do you even have insurance
And
or
making
not?
sure it's the correct patient. You know, there are several people that have the exact same name, first name, last name, and date of birth. So making sure that you actually have the right patient so their medical history is correct within their chart.
Absolutely. Well, here at the Enterprise Summit, they announced a new feature called Playlist feature, which is coming soon to ECW, which is, I would describe it almost as a macro kind of a solution, you know, to be able to do multiple things, you know, across multiple screens. For sure. What's your reaction to this Playlist feature? Yeah,
so to start off, macros, we definitely utilize those in our lab windows and our medication windows. It's great to be able to click a 3-dot ellipses and pick a phrase from a list and import it in instead of having to manually type that out. So again, with the evolution of ECW, it may have taken us 20 clicks 5-10 years ago to get to a certain screen. Now with these version enhancements, it maybe takes us 5 or 6 clicks. But with these playlists, it's going to be a one-click thing that's going to take us directly where we need to be. So definitely reducing physician burnout and allowing those physicians and advanced practice providers to have that dialogue and interaction with their patient to truly be able to care for them in the manner that they would like to.
Yeah. Well, I mean, it's amazing. I actually wrote an article that said clicks is not the issue because the pianist does a lot of clicks, right? You know, and it works fine. It's about training. But I mean, I think that was what's so fascinating when he talked about playlists. Now you don't even need the training.
No, you don't.
And that's
it's right
the
there, right
evolution.
in front of you. Yep, for sure.
Definitely. Well, thanks, Daniel. I appreciate you sharing your insights and perspectives on this, and especially the clinical side, right? We often talk about the administrative side, the front desk side.
Yeah.
I loved hearing about the clinical, so thanks so much.
Thank you for having me, and I appreciate it. I think that working on the front end side with the actual in the clinics with the actual patients has really helped benefit me in this new position on the back end of ECW. It allows me to be able to relate to the patients, the practitioners, and the entire process and workflow in general. So again, thank you for having me today.
Yep. Thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Danielle.
Thank you.